Good day, everyone. This is Dr. Keith Cloete. I'm the head of the health department. I've not had this conversation with you for a long time, but it is important as we're entering the third wave to have a conversation with our staff. Um, I'm reminded when we went into the first wave, how anxious everybody was about PPE. I remember all the video clips and recordings and all the messages that I received to clarify what our position is as a department. It is very good to know that we have, in a sense, provided the PPE to such an extent that everybody is comfortable and know and expect that there is PPE and they will be protected in their workplace. In entering the second wave, we probably learned the biggest lesson we could learn in dealing with COVID. At the time of entering the second wave, we weren't aware that a specific variant, a beta variant, became prevalent and the predominant variant at the time. And it resulted in escalated cases. And because there were escalated cases, the number of people, healthcare workers, that were infected were devastating to all of us. We knew colleagues that were infected. And because the colleagues were more vulnerable and infected, mainly in community settings, we knew family members and colleagues that were not just infected, but also contracted severe COVID disease and had to be hospitalized, many landing up in ICU, and many tragic stories of having lost and having to hear that your colleagues have died. It was probably the darkest moment for us in dealing with COVID into December, into January. And that was our big learning of saying that we need to intentionally grieve and mourn so that we can heal. And then using the February to June period to mourn, to grieve, and to heal. But something quite remarkable happened in that time, is the availability of vaccinations. And rightfully, globally, and in this country, we prioritize healthcare workers as the first group of people to be offered the opportunity to be vaccinated. We are eternally grateful to the Sisonke partners, the researchers, for making the Johnson & Johnson vaccine available to us at the time that Covishield was not deemed to be appropriate to be used in our setting. So today, as we enter the third wave, it is very heartening to realize that 22,900 of our 34,000 staff members in Western Cape Government Health have been vaccinated. That is 66.7% of our staff have been vaccinated. But what we've also been able to do is to track very carefully of the people that have been vaccinated, how many of them have we got documented proof of breakthrough infection? And I can tell you today, to date, we have documented proof in 220 people that has been vaccinated. That is less than 1% of the 22,000 people that has been vaccinated. The more heartening fact is of the 222 people, only 10 people had significant disease to such an extent that they had to be hospitalized. That is a completely different picture of what we faced in November and December. So as we enter the third wave, and it feels like deja vu, because Delta variant has appeared on our radar. Like the Beta variant appeared in November, the Delta variant is with us. It is already causing significant impact. We also internationally, in India, we now in our own shores are seeing the impact that it's causing in Gauteng. We are aware what it's doing in other provinces. So the likelihood of us in this province having significant caseload again is very real. We are resetting our plans for being able to escalate our hospital capacity, our oxygen capacity, towards planning towards a peak. The big difference this time around is we have vaccination on our side. Besides the fact that we can all be vaccinated, and so few of us have been affected that have been vaccinated, we also offer vaccination to the public, the people that's the most vulnerable, the people that's likely to have severe disease that will land up in hospital. So I've seen the most wonderful and heartwarming stories of compassion and care of people over the age of 60 that have received their vaccination. So while we have increased cases, and while we have increased people that will need hospitalization, and we will still have healthcare workers infected, but with milder disease, we go into a third wave, significantly better prepared than we were for the second wave. Besides the fact that we have done the preparation, the healing, the leave, the caring for one another, I believe we have all the ingredients to navigate a difficult period of time with a combination of we've done this before, we know what it requires to be able to go and scale our capacity and help one another and get through this. But at the same time, we have the most powerful weapon for hope and for optimism, and that's vaccination. So I would like to encourage every healthcare worker that's not been vaccinated. There's still 23% of us that's not had the vaccine. Please come forward, get your vaccine. Your colleagues that have been vaccinated are showing you the protection that we have as we enter the third wave. And then for everyone, while we juggle the balls of looking after sick COVID patients, continuing to do comprehensive services, but let's not slow down in giving the one thing we can do as the health sector, that's hope for the society and the community of the Western Cape. Let's vaccinate as many people as we can. And although it's going to be hard, it will be rewarding, because when we come on the other side and we have a conversation of how did we navigate this, I know we're going to look back in pride. Thank you so much for what you do. I am incredibly proud to be associated with every single person that work in our department. You make us all, and Western Cape Government and the people of the Western Cape, proud to be called Western Cape Government Health. Thank you. As we enter the third wave, a very important lesson we learned from the second wave is that we need to be able to be guided by the latest evidence. We need to be able to be guided by data. We have done ourselves proud, and in a sense, we are a model in South Africa and for other countries of being evidence-informed and data-led. What does the evidence tell us as we enter the third wave and the Delta variant becomes more prominent? The evidence suggests to us that the same protective behaviors that was with us right from the start of COVID is still the important protective behaviors. But the evidence now suggests to us that airborne infection and spread is significant. So if we put all of that together, one of the key things we've learned, and we need to be able to show and lead by example as a healthcare sector, is gatherings of all kind poses a risk, because in gatherings, especially in enclosed spaces, the airborne spread of COVID makes it very, very easy for other people to be infected. Therefore, our message has been that we should avoid people in the public as much as possible to avoid gatherings. Our message in the health department, and I've conveyed that message to every department in Western Cape Government and to every municipality, and therefore to every workplace, where at all possible, people should not gather in their workplace. And if they can do their daily duty remotely, we should be encouraging everybody to work remotely. We understand the sensitivity around some of our frontline healthcare institutions not being able to do work remotely. So where people do have to get to a workplace, is please observe the wearing of masks at all times. Please observe social distancing at all times. Please follow through with hand washing at all times. Be mindful of the spaces where you find yourself, the floor space, open for ventilation. Make sure that we don't use too much exposure in the same space with the same people without having open ventilation. As we go into winter, it is important that we observe these very important rules. I know there would be questions about, but how do we do our work when gatherings goes hand in hand with our work, especially around vaccination sites. So we are therefore very strongly advising that people stick to the appointment system for vaccinations, that we are doing social distancing, ventilation, and airing open spaces around the vaccination process. And when people actually physically enter the enclosed space, that it happens as quickly, as fast as possible. So we have asked the National Department, and there will be a specific document coming out about the regulations around the gathering of people in vaccination sites, which is provided for in the regulations that was released under adjusted level 4. So my appeal to everyone, where we can avoid gatherings, please avoid it. Keep your own secure bubble at home secure. When you have to go to the workplace, do so in the most safe possible way that you can do it. And if you look after your bubble, you protect the bubble of the colleague that's next to you in your workplace that you're protecting through your behavior. And remember, just because you're vaccinated does not mean that we must not observe social distancing. The vaccination gives the major protection of the vaccination is against severe disease and hospitalization and death. The vaccination does give some protection, but does not give you complete protection against contracting a milder form of COVID, which means you pose a risk to your loved ones and others that's not been vaccinated. So please let us all work together. We know what the science says. We know what the behaviors are. Let's work together and be the model for others of how to behave to curb the spread of COVID. Thank you. As we were taught in the second wave, when we had the significant loss of life associated with our own staff, with our own fellow colleagues, but also with people that we know from our own personal networks, our own families, our own friendship circles, and our communities. The importance of grieving and the importance to be able to go through mourning, to enter into a healing process so that we can come out and having processed it effectively became very clear to us. That's why we had the intentional grieving and healing process and sessions that we've made available. But we've also then asked and worked through our employee wellness colleagues to provide this on-site and available services for everyone. So we encourage everyone. Loss is something that happens in many multiple forms. And the most healthy thing we can do from a mental well-being perspective is to deal with loss in a constructive way. It is no weakness to say, I feel sad. It is no weakness to say, I need support, I feel vulnerable. Actually, that is strength. It's strength of the highest order to say, I need help, I need support. And I don't just need help and support from my colleagues and my friends and my family. There are professional people that can do it for us. It shows incredible courage and strength to step forward, use the expertise of the professional groupings that are there, the people that we've made available to help you through this mental health and wellness and well-being process. Please, I encourage everyone, call on them, make use of them. The stories I've heard of people that have done it, it is life-changing. And really the whole thing that I would like to encourage everyone is whenever you feel that you are faced with despair and have no hope, that is exactly the time where you need to have the strength to say, I need somebody to assist me because I need to get my hope back and my optimism back. Please use the occupational health service that we've made available to everyone. Thank you.